Welcome back to the show Talk with Your Doc. With me is Dr. Escott, and we are talking about cervical cancer. We are talking about HPV and how we can prevent the HPV infection by taking the vaccination. And if one uses precautions not to get HPV infected by using, say, condom during the sexual intercourse, or avoiding HPV infection at all, or by getting early detection of HPV by pap smear testing. And you mentioned that one should get pap smear testing done at 21 years of age and every 3 years after that. Now, if somebody gets the HPV infection and HPV test is positive, like pap smear test is positive, then what do you do the next?
The pap smears, if they are positive, there's various degrees of positivity. There's the borderline abnormal pap, there's low grade or minor changes, there's high grade changes, and then occasionally we'll get a pap test back that is actually cancer. But depending on the degree of abnormality, sometimes the woman just gets a repeat pap test 6 months later from her doctor.
So that is for low grade, or?
That's for low grade or borderline
abnormality.
That's right. Now, if it's a high grade, which is the cells look a little bit worse, but they don't look like cancer cells. If it's high grade, or it might be high grade, then those women are referred for a procedure called colposcopy. Which is a close examination under magnification of the cervix to determine if there are any abnormal areas on that cervix.
So if HPV test or pap smear test shows high-grade infection, and then you get a colposcopy and it shows abnormal area, then what do you do the next?
Okay, the colposcopic examination is just like getting a pap test. It's uncomfortable, like getting a pap, but other than that, it doesn't hurt. What we do is we look at the cervix under magnification and apply a 5% acetic acid solution to bathe the cervix. If there's any abnormal cells that might turn into cancer in the future, they will show up with this solution as a white patch. If we see a white patch, then we take a little tiny tissue sample with a biopsy forceps, and that usually doesn't hurt.
No anesthesia is required, it's just a local?
It is not required. A little bit of local anesthetic can be given, but either way, even with or without the anesthetic, it doesn't seem to hurt.
It's a short procedure, like 10 minutes procedure, probably?
The entire colposcopic exam is about 10 minutes.
10 minutes procedure. But it can detect the cancer at an early stage and can help us in treatment.
It can, and in fact, since the pap test is just a screening test, it's not that accurate. The biopsy is the gold standard test. The biopsy is the sample that we use to determine what exactly the woman has and how it's going to get treated.
So once you do the colposcopy and you find an abnormal area, you take a biopsy. So there are different types of biopsies, right? You take a cone biopsy, leaf biopsy. Please tell us about those biopsies.
At the first visit in the colposcopy clinic, in a woman who has had a significantly abnormal pap test, all we do is take biopsies. We might take one, we might take 2 or 3, depending on what it looks like. If those biopsies confirm a high-grade precancerous lesion, then we will treat it and get rid of it so that it doesn't turn into cancer. So high-grade lesions, depending on the age of the woman, might have about a 50% chance, if left untreated, to turn into cancer. Now, in younger women under age 25, the chance is much less than 50%. So we don't usually treat women under 25 immediately if they've got a high-grade biopsy. But women over 25 or 30, we do treat them so that they don't develop cervical cancer in the future.
And that is done by the cone biopsy or the LEAP procedure, the treatment of the high-grade lesion?
There are 3 methods of treatment. The first method is, and the one that's been used the most in the past, is called cryotherapy. And this is where an extremely cold probe is placed on the cervix to freeze and kill the abnormal cells. So
the cryotherapy will kill the abnormal cells and there is no need of further surgery. It will just cure the high-grade lesion?
Yes, what happens is it actually kills the abnormal cells and they will slough off and they'll be replaced by normal tissue.
So this high grade, which is not an invasive cancer, which cannot spread to the other parts of the body, it's a pre-cancerous stage, you can say. What are the other options for those?
The other options for treatment after cryotherapy is laser treatment and what we call LEEP procedure. LEEP is spelled L-E-E-P and is an acronym for Loop Electrosurgical Excision Procedure.
Yeah.
So all three of these methods remove the same tissue, which has got the abnormal cells on it. Now with cryotherapy, it just all dies and sloughs off. With laser treatment, it vaporizes,
right,
and gets removed with a vacuum.
So do you need any anesthesia for all this procedure?
Cryotherapy, no. Laser, yes, we do use a little bit of local anesthetic.
Local anesthesia.
Oh yes, just in the colposcopy clinic.
Right. So is there any complication associated with this procedure? How is the life after the procedure?
Well, I didn't mention the third procedure, which is called the LEEP.
LEEP.
That's actually a larger biopsy, and it removes the entire transformation zone, the opening of the cervix.
Right.
Because the HPV virus can live anywhere around that opening.
Yes.
The advantage of the LEEP procedure is that a specimen is actually sent to the pathology laboratory,
right,
and the specimen can be examined under the microscope to make sure there's no cancer in it, and to check the margins and make sure all the bad cells have been removed, because you can't do that with the laser or the cryotherapy procedure.
Right. Now, so after doing the laser or the cryo or the LEEP procedure, how is the life? Is there any complications?
Minimal complications. It's very unusual, but occasionally the treated site can get infected, but that's easily treated with an antibiotic. And with the LEEP procedure, if you go deep enough into the cervix, there may be a chance of premature labor in subsequent pregnancies.
Okay. So if somebody had the cervical cancer in the pregnancy, how that can be treated? Or does it need a treatment?
If it's actually invasive cancer in pregnancy, that's a case for a gynecologic oncologist.
Consultation.
They might actually do a trachelectomy, in other words, remove the cervix.
Right.
But
that
again,
is during
you have
the
to
pregnancy
weigh.
or after the pregnancy?
They might do it during the pregnancy.
Okay.
Or depending on the clinical factors, they might wait until after the pregnancy.
Right. Now, what is the prognosis of the cervical cancer at the day and age with the modern treatment options available?
Most women are cured either by surgery or radiation.
Right.
Or a combination of radiation and chemotherapy.
So if the cancer is detected at an earlier stage, stage 1 and 2, 90 to 100% patients will get cured with the early testing and the methods of treatment, which we just talked about. How about the late stage of the cancer, like stage 3 and 4?
Those are beyond surgical cure, and these are treated with radiation therapy and chemotherapy. And I'm not aware of the survival statistics on those, but sometimes it's curative, sometimes it isn't, and there may be complications from that treatment.
Thank you, Dr. Escott, for coming today and sharing with us. We really appreciate it. Thank you, everyone.